Okay. Start the meeting.
A very good evening to all, and the esteemed members and MC members of HMA and our speaker for the day. And it's great to have Dr. Vasuprada Garu, Kartik, an anthroposophic counselor and psychotherapist and all. And 360-degree psychological wellness today is the topic, and this is very much needed for today's scenario, because all of us are going through lots of stress, how to handle stress through the post-COVID times. And this is where we are waiting to hear from her. And also the theme for HMA is the management, resilience, impact, innovation, and globalization. Hyderabad Management Association is a 56-year-old organization, started with few dedicated managers in the city of Hyderabad and Secunderabad, who felt the need for developing managerial skills among young executives and spreading the message of professionalism among the practicing managers. And by involvement of academia and industry, we conduct various activities at HMA. We provide a platform for professionals, academicians, management students to stay abreast of contemporary management practices, and even shaping the professionals and with their emerging challenges. We conduct plethora of activities like evening lecture meetings and the women program like the one what we are doing, and training programs we do, panel discussions we do, and seminars, conventions, quiz programs, management and faculty and student development programs. And this year we added a certificate program in partnership with the business schools, and we also have various initiations at HMA. Like we have the social impact desk. We are addressing the problems across, and also where the social impact desk is very active, and they are adapting one of the government school for teaching them the best practices of conserving water for future tomorrow. And Kalpana Ramesh is a convener for that. And also IRP, Industry Readiness Program, where Sri Harsha Garu himself is the Dean of IMT, Institute of Management, I think. And he's taking it forward with Jayavant Garu, who is our treasurer, and Ramchandra Garu, our vice president, and Sandhya Sripada, very actively involved in making to see that the students are benefited through this IRP program of ours. And also we do the social, as I said, social impact and MSME desk, where we bridge the gap between the MSME and the government to get them associate, to give the disseminate and give them the best schemes available, also getting associated with the bankers and giving them orientations when and then required on various opportunities also in business. And also we are connected with international consulates across, and international desk, which is connected with the consulates across to bridge the gap between the students, and also a direct connect between the consulate to know what students can have in case they're going abroad for the internships of further studies, and also the trade opportunities across the various countries. So international desk is again handled by a convener, Krishna Prasad Garu, and a convener, Rajendra Prasad Garu is heading the women's and young desk and MSME. They are doing a great job. Hyderabad Management Association is again associated with All India Management Association. It's a parent body, and we conduct various regular joint programs with IMA also. So we are also conducting a program on 4th at ISB through IMA. So HMA ISB collaborate to do a joint event at ISB campus, whoever is interested. But this is only open for HMA members, can register themselves. We need this RSVP to give them, and people who are vaccinated are only allowed in the campus of ISB. And Mr. Munjal from Motors. Mr. Munjal from Hero Motors would be sharing, there would be a book launch, and and also he would be sharing his experiences about Hero Motors, and it's a great opportunity to meet leaders, industry leaders in the platform like this. And today is a very interesting program. As I said, she's a psychotherapist, and we need to know the wellness of each individual. How do we be calm during the stress times? And I thank Vasuprada, Dr. Vasuprada Garu, for accepting our invite and going to share our experiences with us. And I also thank Rajendra Prasad Garu for making this happen. And I would request Mr. Rajendra Prasad Garu, a convener, to please take this forward and introduce the speaker. Thank you so much for this opportunity.
Yeah, thank you, ma'am. Thank you. Yeah, respected our HMA President Kavita Garu, our respected Honorable Secretary Ravi Kumar Garu, and our senior most member and international desk convener SVKP Garu, and our fellow MC members, and my dear esteemed HMA members. Today, guest speaker, Vasuprada, Dr. Vasuprada Garu, and ladies and gentlemen, a good evening to everyone. It's my privilege and honor to introduce today's guest speaker, Vasuprada Garu, in detail to you all for today's evening. Well, as a co-convener of HMA Women's Committee, we organized almost 4 programs, including today's one. The first one we had on women rights by Dr. Lawyer. She's a famous lawyer from Vizag. She gave a presentation on that, Tamasriya Begum. And we had second session is a social entrepreneur, Kalpana Garu. She gave an excellent presentation on water management and restoring the wells in Twin Cities. And third session we have from Diversity Foundation, Sylvania and her group. They gave a tremendous presentation last few days back. We had that session last month, and very high response we got. It's on the impact and challenges of work from home. That was the topic we took it at the time. Now, luckily, we had an evening session by Dr. Vasuprada Garu, and which is very relevant to all of them, all of us. That is 360 degrees of psychological wellness. So it's my opportunity, it's my privilege. I just want to read a small brief bio for you all. Yeah, Dr. Vasuprada Kartik, anthroposophic counselor and a psychotherapist, double masters in counseling and psychotherapy, diploma in special education, PhD in holistic psychotherapy, certificates in psychological first aid, positive psychology, international leadership, and organization behavior, forensic psychology. Special training certified from Switzerland in anthroposophic psychotherapy, training of trainers from UK, core faculty for national training in India for international certification. Presently, a member of international board at Switzerland, organizer and member of the international editorial team for a journal. As a global expert, was part of United Nations pilot project of trauma. As an international trainer, conducted training for psychotherapists from Brazil, Colombia, Argentina, USA, and Chile, also for postgraduate medical training. With work background from elsewhere, NIMH, developing computer-aided instruction for special needs of children. Volunteered in IMH, especially in Naxal-hit police family rehabilitation. Has worked with orphans and women who witnessed or subjected to violence. Was part of SHE teams and Barossa of Telangana Police, felicitated by the Honorable Home Minister. Great, ma'am. Great. Did many trainings for governmental volunteer organization, schools for management and education, was faculty at MAC for organization and management skills. Has been a frequent TV guest and subject expert for over 2 decades of many channels. Great. She is an internationally published poet. Oh, very good. Also a columnist and musician. As a Rotary recognition of peace and conflict, received Vocational Excellence Award, Regional Best Assistant Governor. Presently, District Chair, Addiction Prevention Youth Protection, Member National Core Committee, Addiction Prevention. Welcome, ma'am. It's my privilege to welcome you again to the dais, and mic is yours. Yeah.
Thank you so much, Andy. A very good evening to everyone who's joined. I'm grateful to HMA for giving me this opportunity. to the President Kavita Rajesh Garu and Dr. Ravi Kumar Garu, and of course, Krishna Prasad Garu, who's been kind enough to coordinate all this. Thank you very much. So today I'll be just speaking very quickly on this thing where we will just see about how mental health is literally the neglected part of human being, strangely. So I think we just have to keep into it and try to see how best we can remedy the situation. Sir, I can do the screen share, right?
Yeah.
Okay.
1 minute, ma'am. I think, Karthik?
Yes, madam, we can go ahead with that.
Okay, thank you.
Madam.
Yeah. Wait a minute, I don't see this. This says only whiteboard. No, I need to, just a minute, please. It's not allowing me to share from my device, Karthik Garu.
Karthik, can you give the co-host right so that she can share?
Already given, madam.
No, it's showing only whiteboard, Safari, mail, but I need to have another device that can be used. So is there anything that needs to be done?
Nothing, you can directly share the PDF or?
Karthik, I gave you PDF file to, you know?
Yes, it's there.
Yeah, you can share it so that you can.
Okay, yes, ma'am.
This whiteboard. If somebody can guide me through this, because usually I just do it from my another device, which is my iPad.
Now Karthik can show your slides now because I forwarded to him. Now you can give a presentation by asking the slides to him one by one.
But I thought I would annotate on it, but it's okay if he can just put the screen share. That's all right. Because I think annotation was more important, but it's all right.
You want to screen share, ma'am, with Karthik? Now you can give instruction.
Yeah, we can just move to the.
Yeah, Karthik, I think you can start the PPT.
Yeah.
So as the technical things are going on, I would like all of you to just think whether you know somebody who's ever felt psychologically a little down, or maybe they were a little agitated, or right now I think a pandemic has done a great deal of it has produced great deal of difficulty to human mind. It has not been easy for any one of us. So keep all these in mind, and also the fact that despite all that, we had to continue with our work life, our educational pursuits, and of course, there had to be maintained a kind of a balance in even how we were socializing, irrelevant of the fact that most of it was online. So it has generated a lot of difficulty. Now, can I request Karthik Garu to do the screen share and start the PPT?
Give me some time, madam, because I'm downloading the file.
Okay, sure. Okay. It is useful if we maybe start off talking about this. How will you describe, one of the common things that we always encounter is when somebody says, my child has become very lazy. How many of parents would have said this? So the typical thing wherein you say, why is this person not able to get up in the morning? Why is this person not able to do certain tasks which are meant to be done, like you expect, especially the young people. These days, we see this very commonly in young people. And when I say young, I'm talking about not just children, not just adolescents. We're talking about young adults, wherein they just don't feel like starting the day. And usually the term that is given to that is they say, oh God, this person is lazy. So laziness is the commonly, I think, it's a misnomer for a situation that might require a bit more help. Very often in our clinical practice, we see people who are coming in where, maybe a spouse will, talk about a wife or a husband who's quite lazy, or maybe usually the parents who say, my son is not studying, he's become lazy. My child is not studying, he become lazy. So how much of truth is there in that? Now that is the whole thing. Because the moment there is a diagnosis, of course, we will do the proper diagnostic methods and then arrive at, let us say, a diagnosis which says it is depression, it's not really laziness. How many of us are willing to accept it? The whole point is we run away. We do not want to hear these terms. And for years now, we have been on this task. For me, it's like a penance to talk about mental health everywhere, every opportunity, because everyone should know what it is. Why are we always, running away from things? So, Karthikar, maybe we can just go to the next slide. Yeah. So this is what it is. When there is a stomach pain, we go running to the doctor. If there's a sprained ankle, of course, we run to the doctor. When there's any other injury, we go to the doctor. But why are we so shy to seek help when our mind is troubling us? Why do we think it is something wrong? Now, this is something I want everyone to pause and ponder on, because that is an important thing. Because as we know, India is the country with the greatest of human resource at this point in time. But the human resource can become useless or become not so effective if there is something troubling the human mind. We want everyone, see, as most of you are entrepreneurs, most of you are great industrialists, or whatever, that you are in the segment wherein human productivity is important. Even as academicians, we would like our students to do well. We want them to study well. But what stops this productivity? Because these are the referrals that we get when they say, oh, this child is not performing. And it's very possible. If I tell you that an 8-year-old child can be diagnosed with depression, anxiety, many times you find that young children are having symptoms like vomitings, nausea, diarrhea before exams. And we think, oh God, what is happening? We run to the doctor, but we don't consider that actually it is more of the mental stress that is showing itself. Yeah, can we go to the next one, please? Next slide, Karthik.
Karthik.
Yeah. So we just have to acknowledge that mental health is just as important as physical health. And the reason I'm stressing on this is because it's as simple as, you feel tired, doctor advises take a B complex or, any of those vitamins and eat well and exercise well. We are okay with it. We do it. But when the same thing is said, let us say by a mental health professional, that maybe you need some help to make your mind feel better. Many times I have to give these examples to convince people why they run away when there is a diagnosis given. Because they think we still are in that realm where mental health is considered as madness, as craziness. So anyone seeking help, because you're all in this segment wherein human resource is what we work from, with maximum we work with. And then, how many times a school counselor doesn't have much work to do because nobody in the school wants to go to the counselor because immediately they are talked about. And we see the same situation in a corporate office where there is HR people who are trained possibly with a background in mental health, Nobody wants to go to them. Even if they do, they're not going to share much, because somehow we think, I don't want to be seen running to a counselor. This is where we are stuck, because I don't mind being seen in any hospital, visiting any doctor, excepting a psychiatrist or a psychotherapist. Okay, can we go to the next one, please? Okay, so close your eyes, and the next one, close your eyes, and I want you to think about 4 people, 4 random people that you can think of immediately. Yes. Next slide, please. So the latest statistics, now please open your eyes. Latest statistics suggest that 1 in 4 of us will experience a mental health concern in any given year. What is this statistic suggesting? 25% of us. So in a random room right now, we are this many of us. So think about it. We would be having some mental health concern which we are not interested in acknowledging. The first one is we do not want to acknowledge. And the second one is to address it. These are the 2 major things. We do not want to acknowledge it. And definitely after that, we do not want to address this, because the many myths that come about, we will speak about it. Next slide, please. So we will just look at some of the symptoms and signs. What should we keep an eye out for? This is important, whether you are in the workplace, whether you're at home, or whether you are just an interested community member, as a good neighbor, as a good, any community member. Okay, next slide, please. Next slide, yeah. So the things that we need to recognize, which we all keep throwing aside, are there is a change in appetite, there is a disturbance in sleep, whether you are sleeping less or you are sleeping more, and sometimes these anxious and repetitive thoughts. So typically, a lot of jokes are cracked about it. Hey, this person is a worrier, goes on worrying about something, but we're not really looking at why. And then there's a low mood, hopelessness, panic means that it is a higher level of fear, lack of concentration of focus, uncharacteristic changes in personality. So these are important. When I say changes in personality, means a person who's very boisterous, who's happy-go-lucky kind of a person, who's happily doing something, suddenly is not that. Or sometimes a more sedate person who is quiet and calm suddenly is also extremely exuberant. Now, both are not normal. There is a change and we should be looking out for it. And of course, being overactive and losing temper. Okay, next one, please. So on the right side of the slide, you see all these different things that we usually keep seeing. But yes, if there is any episodes of crying and new or increased addictions, so it can be. So when we are talking about the addictions, please don't think that it is always alcohol and drugs and smoking. Addictions are many. Starting with right now, addiction to electronics devices, right? Social media, all these things, and also not talking to friends, family, or isolating oneself. This is seen. See, all these we are talking about because you could help somebody who could be having these, or it's very possible that deep inside me, even I want to be the same way. I want to isolate myself from friends and family. I don't feel like talking to many. Increase in headaches, body aches, tight jaw, grinding teeth, forgetfulness. Now, this is something which we all again think that it's okay. Hey, I'm growing old, so I keep forgetting some things. We have to check, is it really that or is it something else? Flashbacks of painful events. So sometimes we all go through painful events, and pandemic has made sure that all of us understand what is a painful event. All of us have memories, have experiences of the pandemic. whether it is indirectly or directly, but the amount of pain that a human soul has suffered is not little. And when there is a personal loss, of course, it's much, much more. Then fear and shame, because this is another thing which is very important in terms of the success, the concept of success. So children, exams, work life, promotions, all these, if they don't happen, are we carrying some fear? Are we carrying some shame? Is somebody likely to judge us? So these are all things that why are they going to be more in some people and not others? Okay, next slide, please. Now, these are the next ones that we should see. Common myths. Extroverts who are active, smiling, cannot be going through depression. Okay. So usually it's always a misconception, because depression can be easily masked and expressed in many different ways, which we are not aware of, we don't see, because obviously we're not looking at it. We go with the myth that all those who are cracking jokes or appearing to be fine or going about doing their work cannot have depression. This is a myth. Anyone who is exhibiting other things, whether there is a change in personality or their sleep or appetite or any of those things, please watch out, because just because somebody is joking does not mean that they do not have another issue. And then, yes, so in a group, a person's moods and emotions are not influenced by others. No. All events and people and moods can affect us. And we all know this. If you go to a somber place when something is going on, we also feel that. When you're watching some event, of course, we feel the same pain. Or when in your company that is very exuberant, it can affect us. So everybody is laughing, I'll also laugh. Right? And then this is one myth we have to get rid of. That is, there is only one solution to dealing with stress. No, there are multiple, many, and we can find solutions in everyday life. I think that is very important. Everyday life and how we work with life itself is a therapy. Itself is an intervention. But first step is that we have to admit that I need help. I have to admit that I need to work on this. Or it can be others, because we have the tendency. There are many people who are very productive, who are great achievers. They do not like to accept that others cannot function at that level. Especially we see this in parenting. We see this possibly at work, that, yes, come on, be as productive as me. I mean, I'm able to do, how come you cannot do this? Now, people are different potentials. And maybe the person is having something on mind which is so distressing that they're not able to perform. Next slide, please. So again, as we talked about, for the larger picture is we see it as happy. But if you look close, it's all filled with the word sad. So the hidden emotions, how we understand, how we perceive a person, how we are trying to look at them and train is more important. Yeah. Next slide, please. Now, this is another thing we need to work with. So everyone all the time, I've heard this many times when people say, this one just doesn't have the willpower to overcome this. It's a very common myth that willpower can cure a person of anxiety or depression. No, there are many more things to it. They need support. Nobody likes to be depressed. First and foremost, I think we have to understand, nobody enjoys depression, nor nobody enjoys a low mood, nor does a person enjoy being anxious. Okay, so we cannot say that this one just doesn't have the willpower to overcome this. We can see this across, when there is a talk about one person who's not feeling well or not okay, it's very strange, isn't it? When somebody has a fracture, people go running, see them, and, friends write on the cast, they give autographs, they give love messages, all these things. The cast is glorified. The experience of recovering from a fracture is made very nice. But when it is a mental health concern, it is not. It is hidden in the house. It is hidden in the rooms. It is hidden from people because nobody wants to talk about it. Nobody wants to take help. And families or as professionals, as colleagues, as good neighbors, it's very important that we make them feel as special as somebody who has a caste. So I ask the same question to people. Why do you expect a person with a mental health concern to do everything correctly? We never do that when somebody has a fracture. We tell them, hey, recover, get back, get well, and then you can come back, you can do other things. So the recovery time is important, as well as the physiotherapy, that is, in this case, the psychotherapy or the counseling, along with sometimes the medications. All these are important for a person to come back to normalcy. And they deserve the same love, affection, and the concern from whoever is around them. The reason people run away from even acknowledging that they have a problem or they need some support is because of how we react, how we as people react around them. Okay, so can we go to the next slide? Karthik garu?
1 minute.
So, yeah, the next one. Please try and understand what are the components that can affect. So there is a biological factor, there are genetics involved, because we keep saying, I'll sometimes use a bit of Telugu or Hindi just to give that sense. They say, nanalaga kopmekwa. It's very easy for people to draw these personality traits and feel okay with it. But maybe some of them are not that good. Okay. And of course, health, because if my health is not all right, I will feel anger, depression, anxiety, all these things come when my general health is not okay. And if I'm on certain medications, there is always another effect. Of course, drugs and alcohol, we know, they changes person completely. Now, what is more important is a simple thing like a self-esteem or a coping skills. Not everybody has the same mechanism of coping skills. It's like, we can have a simple example. Do you tolerate 43 degrees without sweating much or feeling faint? Or do you tolerate cold? So it's like how some people are able to do it, some cannot do it. So it's almost as if, how our bodies are reacting, our minds are reacting the same. So sometimes we have to take good cognizance of it. And social relationships. Why are some people not able to maintain good social relations? Why is there a difficulty with that? Why is that a challenge? And family and friends, how are they treating? How are they with the family members, or how are the family members with them, or friends with them? And yes, here in this context, co-workers, peers, because many times now I can say that on an everyday basis, I work with people in work life coming with issues about what's happening in their team, what's happening with their colleagues, what's happening with their bosses, and of course, what's happening in their personal lives as a result. And then, yes, young people, college, then what's happening in India, all these are things that are affecting us. So we need to be careful as to how these things are affecting us and where do we use the filters So when we are talking about maintaining mental wellness, it's about how do I maintain my own filters so that I do not take unnecessary things? Where can I keep out all the nonsense and take in what works for me? So usually a lot of young people come and say, my parents are such horrible people. Okay, a lot of things, these, so don't get worried. I'm just giving you something. But finally they understand that it's the parents who are actually caring for them also. And that's important for them to have a change of perspective. And it reduces how we look at the, the stress, the feelings of low, because you start feeling that I'm cared for, that actually people care for me, that I'm in a better place, I'm secure. So as much as how one person is taking in as a perception, it's important for us also to generate that environment. How do we make a person feel safe, secure, cared for? And these are important because the more we do it, it comes back to us. We know that, right? So if we want somebody to be nice to us, let us start by being maybe more caring for them. And of course, caring for ourselves. Be aware what is triggering any of the emotions, whether sadness, anger, any at all. It's always important to be self-aware. I'm sure, you would have had many workshops, you would have known about how self-awareness is the key to working with one's own self. And of course, we have to realize that we are the only people we can have a control on. So ideally, we need to work more with ourselves rather than saying, why can't that other person change? Why can't my life situation change? So it's all about, yes, can I see the silver lining? How do we change our perception? How do I say, actually, despite all this, this person is actually has such beautiful attitude. So we have to shift our focus from the negative to the positive. So I'm saying these are things that we work, and in a psychotherapeutic or a counseling setup, we work very hard to take a person through this journey. They need that support. It won't happen just because I feel like lecturing them for half an hour and they're going to have a quick change of mind. It needs support. So it's like, yes, I have to, again, I'll go back to the simple example of, if I have to rework my broken leg, I need crutches, I need a cast, I need support, I need physiotherapy. Exactly the same process for human mind. When it is feeling little broken, it is feeling that it's not cared for. Okay? Yeah. Any more, some more, please? The next one. Now, of course, I think this is the most relevant. So in occupational health psychology, it's proven that yes, increased workload does cause mental health issues at workplace. And there are many cases of burnout. People, unfortunately, in certain cultures, like even starting with India, and the most being more Oriental countries, we glorify hard work. We glorify excessive work. If I say I'm working till 12 o'clock, everybody says, oh, that's so great. Oh my God. Actually, somebody has to say, don't do it. Are you crazy? But we don't do that. So we expect children to get maybe 99%. And of course, we do have a system that is expecting so much from us. Because if somebody has to land a great job or land a good seat in a great institute, they have to really work very hard. So we see cases of a person who's a young person who's studying in a premier institute having a burnout by the second year of study, because they've studied so much and landed this good seat, and the coursework is difficult, and then they have a burnout and their only aim is, I want to quit. They cannot function. So what is going wrong here? Where are we making the mistakes? The mistakes is, yes, we are not taking care of ourselves in terms of, I always say, have pit stops. We cannot be like race cars and not have pit stops. We all know race cars also go very fast, do many interesting things, but they need pit stop. They stop, they get their fuel, they get their tires changed. So it's like how much care is going into yourself in order to work with the whole thing of everyday environment, the bullying, the cliques. You can read it on the slide, and how my personal issues can be brought into workplace and I'm not able to be effective, or my workplace issues are going back home and my personal life is affected. This is the most common that we see on an everyday basis. And how a person completely has a breakdown because, yes, I have a mother and I'm the only child. I have a mother. I have lost my father. I'm alone at home supporting this mother who needs constant medical care, maybe terminal illness. And then I'm supposed to produce all the work and then be a good daughter. Anything, I'm talking about 1,000 things. But yes, where do these people get their support from? Is a community giving? Is a workplace giving? Who's giving them? So, and how do they have to sustain through this? So how important it is to schedule these breaks or schedule, I keep saying, you know, why is it so important to have the quiet space, just the quiet space? The moment you get 10 minutes, please don't open your phones to check urgently what's happening. The 10 minutes is for you to reorganize your own mind, your own body, your thoughts, your feelings, and to have an idea of how are you behaving like, what's happening with you, right? And it gives us that perspective to move back a little bit and to look at everything. So only in quiet places, when you're calm and you're doing certain things, you get a perspective. So don't be in a rush all the time. We all wake up. I'm also guilty of it. When the phone rings, you wake up with a start. You're wondering what's happening, because as a therapist, I know that I get emergency calls. So my phone is never off. It's never far away from me. But yes, it is difficult when we all have this kind of work schedules wherein we are supposed to respond very quickly. But yes, how are doctors surviving? How are people surviving? Because they know how to take these small breathers, breathe, take a break, be with your family. Make sure that there is a connect between generations. Parents are supposed to be the friends of children. Children need parents who are friendly. Parents need children who are friendly. This is our necessity. It's not a luxury. So we need to create that space so that something is going on, we should be able to identify it. Whenever there is a suicide, people like us, we almost have a small death inside us. We feel, what have we done wrong? How come we didn't reach there? And somewhere these gaps that come, the lacunae that come. So whether it is workplace stress, whether it is academic stress, whatever is that, it's not a big deal. Open up and speak. I think everyone needs to share. Talk about it. Nobody is judging. And if we are likely to judge, we need to change our ideas. And only when I'm convinced that nobody is going to judge me, that people will help me. I'll give a simple example. When a child is growing up, they've dropped a bottle of water. Glass bottle, it broke. What's the first reaction? Of course, the mother or father will yell, say, are you stupid? Why did you break it? You should have been more careful. XYZ, right? So now what happens is, these are the small things that build an idea that, yes, am I going to be careful is one part, but the thing is, they relate it in a very different way. It's about saying, okay, I did something and my parents yell at me. That's the only direct connection that is made. And if you're telling, and usually the way we communicate, so we like somebody, we say very nicely, but if you don't like something, how do we communicate? And those are things we need to train ourselves and others. Usually, when you have a problem with a behavior, please keep it as a remark around the behavior. But what we say is usually the worst thing that happens is we always say the good boy and a good girl. Absolutely not. Then it changes the perception. So this happens a lot at workplace too. The reason I'm drawing many analogies is because parent, children, workplace model is the same. A team manager, a team leader, a manager, everybody pretty much falls into the role of a parent. So how do we have this communication that we become a part of a system that is helpful to each other? That your team should support you, that your entire workforce should support you, or you become the supporting force for them. Yeah. So these cliques and bullying are there in schools, colleges, workplaces. I see them very often. So I'm just saying, yes, we need to take a break, build relationships that are based on trust, build relationships that are not judgmental. We don't judge others. We don't always talk about the success, rather than we can say about the other qualities. Do not. As long as we are in that mode, it's difficult for people to open up and speak. Okay. So these are some things I'm just talking. Yeah, maybe I think we are running out of time. Yeah. Next one, please. Yeah. So our personal and social lives can affect our work, like global events, national laws, of course, the personality, your past experiences, and friends and colleagues, family life relationships, personal finances. Of course, we all know how difficult it is when I have a financial situation to take care of and I'm supposed to be functioning 100% normal. So maybe the caution is that, yes, how do we maintain finances so that we don't go into the red? Or if there's something that we require as help, to ask for the help, because everywhere there is help possible. We have to just see who can do this for us. And yes, as for the real-time news, some people get these obsessions to watch, like literally, I use the word because 24/7 there's a news channel on. And then now with the pandemic, we have seen many things and they have affected people very badly. So one thing is, please go back to your hobbies. I always tell people the one thing that helps us is having your own personal hobby. Close your room door, play the music that you like, and dance. Nobody is going to judge you because it's yourself. Enjoy things the way you need to. Remember what you did as a growing up child, the fun you had. What were you doing at that time? Maybe you were playing some hopscotch, maybe you climbed trees. Do it. Do interesting things, fun activities. Go play in the mud, go to a beach, walk barefoot in sand. We have forgotten many of the simple pleasures. So the whole thing for us is, how do we bring ourselves to enjoy the simple pleasures that make a life interesting? Stop on the road and eat one mukkabuta, have one corn on the cob. Do something, simple things, because these bring back fantastic, beautiful memories. Those have the power to rejuvenate your mind, your body, everything. And yes, culture, as much as we talk and boast about our culture, yes, it's fantastic. We also have the stress that comes with our cultural things like festivals. I can tell you, people, every single festival causes a lot of stress to everyone. So be mindful how you're doing. Be mindful how your family is working around it. Be mindful about the friends and colleagues. And yes, also the past experiences. All of us need help to talk about what has possibly come as a burden from some past experience. It's not a shameful thing. It's not a sad thing. Nobody is going to judge you, and least of all, any mental health professional. You can talk about anything under the sun. And we are sworn under that oath of confidentiality. So no, nobody will ever know. So usually we have these things, where people come and ask, okay, so how did this session go? Did this one talk about it? We say, sorry, nothing can be shared. Because everybody needs to know that there is a secure place to talk about what I have on my mind or things that I need to talk about, unburden myself. The things, it's like hanging a coat outside. On a rainy day, you leave your umbrella or raincoat outside and enter the house. So sometimes we need to do that. We need to leave behind certain things so that they dry out and they are ready. Okay, so memories are the same. So we have many things. I have done a lot of workshops on growth mindset, positive psychology, positive attitudes. All these are simply because they are the rejuvenation. We need to be growth oriented. We need to know that these are the possibilities existing in front of us. If I'm burdened by the past, I do not move forward. Okay. Yeah. Next one, please. I think we've finished, I think. Yeah. So now this is the one thing that I wanted to talk about. Sorry about this. This is the last one. So grief, I think we have seen, whether personally or we have seen in our friends, family, and it has been the most difficult thing because I did a lot of grief counseling, and it's not easy. As a therapist, it's not easy. And imagine a person going through that grief of suddenly losing a parent, a friend, a neighbor, anything. It's grief. So we have to deal with it in the best possible way. And please do talk. The only way grief resolves is by talking about it, by looking at things. There are many times it beats logic, I know, but getting some help is always useful. So the recurrent dreams that happen, so all these require help. Do not think that everybody can find their way back, they can bounce back on their own. No, all of us need help. So that is something which I wanted to tell you about grief, that sometimes how you train your mind to somehow attach to the good memories. Because the only thing that happens is we are only concentrating on the loss. Of course, it's a loss. It's never easy. Time is a healer. Of course, we need help to make peace with it. And pandemic has done that too much of loss has happened. Too many things have happened. But yes, grief, all of us have experienced. It's not easy. So what I'm just saying is that one, we can be a helpful community to each other, but also remember there's nothing wrong in seeking professional help. It's very important because a completely unknown person will give a perspective which is different. A professional will give you a perspective which is different. And we all need it. There's no exception to the rule. We cannot be brave because typically everybody says, exactly, we can fight our own battles. No, we cannot. We shouldn't also. Why should we? When we have a system around, take good help. You don't have to fight any battles on your own. So we need to become a community that supports each other. And wherever possible, we need to take the help of a professional who can help. It's okay. Just like you have management consultants who help all the businesses grow. Come on, have psychological consultants who will tell you how to be happy in your own mind, how to make it better. They're like doctors. It's like, yes, you need vitamin D to get your bones stronger, teeth stronger, calcium to get stronger. We'll do the same with the mind. All of us need that. It's nothing wrong. It's daily dose of vitamins, daily dose of nutrition. So I'm just saying that for everything, grief is handled better by people with better habits. Somebody who exercises more, who is more social, because somehow it does bring back our biological factors, physiological factors, everything into more balance easily. So good nutrition, all these help our mind. What is happening within our mind. Next one, please. Yeah, so as we said, social support, we can go to the next one. This is the only thing I wanted to cover because this is very women oriented and I just will finish in 2 minutes. So pregnancy and postpartum, when people talk about maternity leave, they think it's a luxury that they are trying to focus on children. But I can tell you, there is a lot of wisdom in whatever have come to us through our culture, where they have taken care of women who are pregnant, the expectant mothers, and they were given a lot of care even post childbirth. And somehow we have left that behind because now we are very happening women. We need to be working all the time. People boast and say, I work till the day I delivered my child and I got back to work in no time. What happens is that, let's not forget that there are many biological components to this. The whole body is going through hormones, a change in hormones. And not all people have the same brain chemical components exactly the same balanced way. Sometimes it can be different. So my changing hormones can affect me more, or maybe my life situation is affecting me more. So we need to see what is causing this pregnancy blues, baby blues. This is not a myth. It's not a joke. There are many jokes, of course. There are many jokes about menopausal women. There are many jokes on pregnancy blues. There are many jokes on PMS, premenstrual stress, premenstrual syndrome. There are so many jokes. But let me tell you, as much as I would also laugh, because, well, it doesn't look good if I don't laugh. But at the same time, I can tell you, it's reality. Premenstrual stress or the premenstrual syndrome is not a joke. Women feel horrible. So all of us feel horrible. We feel miserable. But we need support from each other. So let's not push it aside and say it's a myth that super women don't feel all this. All of us feel, because biologically, we are prone to certain things that change. And it's important to acknowledge it. It's important to have better rhythms of what's affecting your sleep, or is it making you cranky at that time? It's not, well, for the heck of it, for laughs, we can laugh, but let's also not forget to acknowledge that it is reality, that somebody needs help. Women need more support. So it's possible that they're not being so productive during premenstrual syndrome, the PMS time. Maybe they are not productive. So we need to understand, where is it coming from? How much support do they need? Similarly, all the pregnancy and postpartum. Recently, there was a doctor who actually committed suicide over this. And, there was a talk about it. It was in the papers. And this is something which is not okay. We need to help each other. We are a community that supports each other. So as men, as women, and I can tell you, women are more, they want to be stronger than men. For some reason, we want to be super women. And actually, no. In order to sustain ourselves, in order to be a healthy person who's going to sustain for a long time, we need to take our breaks. You need to relax a bit. If you're not feeling okay, it's okay to tell the others. Many times I've seen how people hide their illnesses, whether physical or mental. So you don't have to hide. I think this is a request to everyone. Nobody is going to judge, because if we judge, then we are depriving a person of a chance to seek help. So let us as a community work towards this whole idea that we need to be an open community to help others talk about what's on their minds. Yeah. Next one, please. So these are all the ones that you can see, the nutrition, addiction, and strangely, we also have fitness issues these days. People are obsessed with gymming. That's another thing which I can talk about later, because gym has become an obsession, and as much as it is a good thing, people who have been told by their orthopedicians not to enter the gym are still going. So then we understand, okay, this is an addiction. Okay, yeah. So please move forward. One more, next slide, please. So yes, this is the one thing. Never do we have to say that I'm a social drinker. This is a myth. Social drinking is a myth most of the time, because before you realize, the social drinker is drinking every day. So as much as, and this is something we see now in younger crowd much more, because they don't mind serving drinks to others, or they don't mind having drinks on their own every day as they're watching TV, and they say, I'm tired, so a couple of beers will help me relax. So the question that we need to ask is, what about the people who are not having beer? Are they not going to relax? So these are the questions. It's all about, yes, one step leads to the other. Be very careful and cautious about why you feel the need to have a drink. Is it maybe you can pick up the phone and talk to your friend instead. Don't have a drink. Okay. Yeah. The next one. Okay. So many of these things, as you can see, they're visually, you can see the descriptions. All these are there. Next one, please. As I have been saying, take breaks when you need them. Remember your hobbies. And yes, you have to decompress. And then, yes, do not judge yourself or others. And then, of course, do not be afraid to reach out. I think this is very, very important. When I'm not feeling physically well, people do go to doctors, but unfortunately, I will also bring one point, please. Women somehow are the last to reach the doctors. It is proven, research shows that more women cancer patients have reached despite having all the symptoms for many years. So please remember that you cannot neglect even your physical health. It's not okay to do it. And definitely not mental health. Okay, yeah, next one. I think we have come to the end. Yeah. Eat nutritional, yeah, balanced meals, exercise, and of course, please recognize if there is a dependence, because it's important to acknowledge that I'm depending on a substance. It can be alcohol, it can be cigarettes, it can be my mobile, anything. Please recognize it and focus on your strengths. Please remember that you have to focus on your strengths, that you are a strong person, that you can do many things, because sometimes when things go wrong, we believe we are at the rock bottom and we can never climb up. And that's not okay. Yeah. Next one, please. Yeah, so this is the whole ending of it. Please remember, nobody is going to judge you when you're going for a walk to lose weight. Nobody is judging you when you go to the gym, because everybody tells you, hey, you're doing great. The same thing has to happen when somebody is seeking help for their mental health. Please encourage people. And if you need, please seek help, because that's what keeps us 360 degrees fine, because my mind is a part of my 360 degrees. I cannot be, right? So please do remember that it is physical, mental, emotional, spiritual health that is making it the 360 degrees. So please follow what is important. Yeah. So thank you for that. Karthika, you can close the presentation. I think it's done. Thank you so much. And I know I have overshot the time.
I have a question. I have a question to Dr. Vasuprada Garu. Vasuprada Garu, it's usually in human nature is that we are very judgmental in judging people. So, but at times what happens is, whether we are right or wrong, I'm not sure, we openly tell it across. So not looking at the other emotional side of a person. So, but is that good or bad? You know, being frank and telling them, and this is what I feel about you, and how does this work? And also, coming, many of us, you know, as you said, the stress we carry at home and we burst out, and finally, once we get out of it and we feel fine about it, but you're causing stress at home by just venting it out. So, but how do we get composed over situations, you know, but we need to vent out it to somebody across.
So what I would suggest is, see, it's important to find somebody who's neutral enough to diffuse a situation, because you cannot, it's like a pressure cooker, right? Mind is like that. I'm going to carry a whole bunch of them. Of course, I'll let off steam someplace if I'm not careful. But if I'm doing it in the right way, obviously, you know, maybe usually friends, colleagues, you know, make a system which is supportive enough to not, you know, went out in the wrong way, but somebody who can give you a kind of a perspective. So we start with family and friends, but sometimes it is also important to seek some professional help, because yes, you know, professionals are nobodies to you, right? So they completely have a different perspective. They have a different take on the situation, and it helps a lot, because, well, you know, nowadays we know about coaches. That's because, yes, I mean, somebody is helping, but deep down inside, we all know that there is much more that's happening. So something is driving me. I do have a specific, I'm programmed to think in a certain way or to react in a certain way. So we need to be quite careful how those things are identified and worked with.
One more thing. I'm sorry, too many questions to be asked. Yeah. I see many people with lots of aggression around. Yeah, they go to the past life regression therapist and all. Is that recommended as such? So what is the difference between a psychotherapist and a past life regression therapist, you know? So usually I've seen many of them, they say, okay, you better consult past life regression therapist than the therapist here.
Okay, so my take on it is very simple. See, let's deal with the problem on hand, which is like, you know, let's take a simple thing. I cut my finger. The first thing is, I at least should put a band-aid and think about what's happening, right? I cannot think about why is that, you know, that blade interested in cutting my finger. Okay, so I'm just saying, I'm with no disrespect to anything. I think it's important to start with the simple things. Start with simple counseling, simple work, simple everything. And then if needed, other things are there. But, and sometimes people run to a psychiatrist. See, I'm saying, keep it simple. Reach out to the people who can start with the basic things. So we go to a general physician and who will guide us about the basic things. Only when something is identified, you say, okay, let's go to some other place. Yeah. So I'm just saying that it's important that we identify how to seek help and how best to deal with it at what level, because those are all different therapies and they're not conventional therapies. It's a different thing. We start with simple counseling at workplace, you know, like coaching. So counseling is the first level. Now psychotherapy is a therapeutic intervention which is meant for things which are of higher nature. So maybe if I'm a little confused, I need career counseling, I can go to a counselor, I can go to a career counselor. But if I am feeling depression, which needs a different therapeutic intervention, or anxiety, or even obsessive compulsive disorder. So I'm talking about the moment they come into the disorder segment, ideally it's not the counselor who's working with it. We need more trained people to address the more complicated ones. Okay, so then wherever there is a situation, the moment it is identified as, yes, this requires medical help, automatically the medical person is brought in. Because then it makes more sense. Because we are dealing with, there is much more picture to it, because it's not simple thinking. All my thoughts are dependent on what's happening at my brain chemical level. All my reactions are also pretty much from there. So if there is some difference there, well, we need support there, isn't it? So
Right.
that's how we need to address it. Take it a step-by-step process. We cannot just say, I will jump from here to there. Makes no sense. And of course, I'm not trained to do long jump. I cannot go. I should prepare myself. So for every single thing, we need a step-by-step process. It's like saying, I will go for a CT scan, when actually even an ultrasound has not been done. Makes no sense, right? We start with the first step, always.
Thank you.
Yeah, thank you.
I think Rajendra Prasad Garu, you can read out the questions. Few of them are posted.
I'll do that, ma'am. Yeah, one question, ma'am. Actually, they're asking about your contact number and clinic location.
Okay, see, right now, most of my consults are happening online, because I do have a bit of a difficulty making people follow COVID protocols, safety protocols. So we have a lot, most of my consults are still online. And you can reach out to me from the number that maybe Krishna Prasad Garu can share. Yeah, because usually I don't really hand it over to somebody else to fix my appointments, because based on the cases, I give the time and the day, depending on how, because the first timers need more time. And yes.
Yeah, okay, ma'am.
Yeah.
The second question from our SVKP Garu, that is Venkat Krishna Prasad Garu. Dr. Vasuprada Garu, excellent talk on things. I think you can speak. You can speak, Prasad Garu.
Yes.
Yeah.
Vasuprada Garu, this is just about, I mean, you already touched the subject when Kavita Rajesh Garu has asked you. When it comes to counseling and, medication, okay, when you are actually trying to treat depression, most of the younger generation, are actually treated with it. There is a general understanding as a school of thought that we should avoid medicines and rather we go for counseling. Okay. Is it because it has got more side effects that the people would not like to go for medication? Do you think counseling will be a better alternative than antidepressants? That's my straight question. Okay.
So no, there is, sir, basically that's not an alternative. As I mentioned already, we start with the first step. So there are people who are having, let us say, something called reactive depression or something. There are situations which will help. They get benefited immensely with counseling and psychotherapeutic work. But there are times they require medical help. And to say that the medicine is not good at that time is wrong. It's like, I have an infection, but I refuse to take my antibiotics because I do not believe in it. So the whole point is, you need some help, whichever form you want to take. But it's about, yes, how do we get that help in order to come out of a situation? Because not all forms. If a suicidal person is a high-risk patient, I mean, we call them high-risk because I do not know when the mind is going to be how. We need help. We cannot say, well, counseling chesta aipothundi. Those are the kind of things I ideally should not even have as mindset, because certain cases need medical support. And there is the myth is that, it causes permanent dependence. No, it's a myth. When the symptoms and other things are managed and they are becoming more and more functional, the doctors withdraw the medication. So it is never that, lifelong dependence, that, somebody has to be on certain things all the time. No, these are myths. So we can very well, we have to work with the step-by-step process. That first level is basic counseling. People make a lot of mistakes. They think that a counselor can handle, there is a difference, Andy. There are counselors, there are psychotherapists. Now, psychotherapists are trained people to deal with more difficult cases, more mental health disorders. Counselors, as we know them, simple counselors are dealing with only simple cases, which are everyday issues, very small level. Okay, then the psychiatrists are going to deal with the medication part of it. Okay, so we need to understand who, in what order we need to go. Usually, yes, like somebody like me, I'm a counselor, psychotherapist. I'm trained, with a lot of medical background as such to understand medical cases. So psychosomatics is my interest. I have done a lot of work in that. So what causes certain health issues? What is the background? What is the mental background behind that particular illness? So psychosomatics is another very important part of mental health and physical health these days. There's a lot of importance given to it. So, it's a spectrum, and we need to understand who needs to go where. And we go to as I said, the simple first step is always the simple one. If it is required, always the referrals are made. And then let's not have any taboo about that medication is wrong. No, medication is our friend. As I said, we need certain medications to overcome a certain situation. After that, the medication is not going to be with us. It's going to be withdrawn and taken away. We don't need it. It's only used as a necessity thing. Yeah, thank you.
Yeah, I think we are running short of time. Actually, I think I request Ravikumar Garu, Ravikumar Jain Garu, our Honorable Secretary and Director of Symbiosis. I think giving closing remarks, sir. And
the more we talk to Madam, we have more doubts.
Yeah, absolutely.
The topic is like that.
Yeah.
Thank you, Rajendra Prasad Garu. My compliments to you. In fact, the Women Development Cell started a little late, but is all over the place in the last 2 months with two mega programs, and this session, very, very impactful session.
Absolutely.
Sir, excuse me, sir. 1 minute, sir. Sorry. I just want to announce, sir. 1 minute. Actually, I want to announce, I forgot to announce. Next month, we have a great session in there on Women's Development Committee, Global Senior Women's Day on March 11th. We have a global summit, and that one, our President Kavita Rajesh Garu is addressing HMA Women's Development Forum Committee. To addressing the panelists on that particular day about women empowerment. I would like to share it on this platform. Thank you, sir.
This is going to be a global conference in partnership with HMA, Symbiosis, and Diversify.
Yes, sir. Yes.
So, there I Durustai in Hyderabad, they say, Rajendra Prasad Garu, the Women Development Cell started late, but it is a pinch hitting, big programs and global programs. So happy for you.
Yes,
wonderful job. Vasuprada ji, it is my privilege and pleasant duty to propose a formal vote of thanks on behalf of all the members of HMA. And when I say HMA, I refer it to as Hamara Management Association, which is Hyderabad Management Association, and all the esteemed management committee members of HMA. The convener of the Women Development Cell, or a new vertical we started this year, Rajendra Krishna Prasad Garu. In fact, he took charge of this vertical when he saw that nobody is attending to it. And he's putting up a fantastic work and a fantastic contribution to HMA. And all thanks to you for such a impactful, I must say impactful session. And when I say impactful, being an academician, I can tell you that any session which has more questions means it is well received. And I think your session, the questions are testimony to that.
Thank you.
And you have touched upon a fantastic, every aspect of life which we are all going through as individuals, as family, in the family, as parents, as administrators, especially for academic institution. I can identify with some of the issues that you have mentioned when we are counseling parents as well as the students. And many a times we feel that parents need more counseling than the students.
Yes.
I have had a lot of tough situations where I had to really tell the parents, somewhere you need to visit, you need help. So I think a nice session with comprehensive coverage of possible psychological aspects. Now, when we say psychological aspects, you rightly mentioned that people have a taboo of psychology means something wrong. It is not something wrong. Unless you address it in time, it will turn into something wrong. So I think point well driven home, Dr. Vasuprada. Thank you so much. And I once again thank the entire MC members, our president, who is the, I would say, the powerhouse behind all these activities. He has been driving with a lot of grit, I must say. And this I said with whole heart when I said at the beginning, if things are, as long as things are managed by women, they will always be good. And Kavita Rajesh Garu is again a reflection of that.
Sir, I should thank all the MC for shouldering my responsibilities. Thank you.
And our vice president, he is not here today, but he is also one of the, I would say, vibrant and very active person. Despite his age and seniority, he does a lot of interesting things, and we thank him for that. And our evergreen and multitasker SV KP Garu, SV Krishna Prasad Garu, he is the man who brings in a lot of value to HMA. And all other members, our treasurer, Jayavant Naidu Garu, and all other members, thank you all for being part of this evening. And thanks to our own students from Symbiosis who joined this evening, 25 of them as a part of the session. And I'm sure they are all benefited today. Thank you all, and we look forward to have you for many more engagements in future, Vasuprada Garu. Thank you so much. Jai Hind and Namaskar.
Namaskar.
Thank you, Vasuprada Garu, for accepting, and we're looking forward for a strong association with you. Thank you. A great evening to all. Thank you, sir.
Thank you, ma'am. Thank you. Thank you.
Thank you.
Karthik, you may call up the meeting on a count of 3.
Thank you, Karthik, for you know.
Thank you so much. Wonderful session, madam. Good to have you at HMA. Continuing in future also. Good day, everybody. Ending from start 1 to 3. 1, 2, 3. Ending. Thank you.